Hi everyone and Assalamualaikum. My name is Najha binti Salim and I am from Bachelor of Psychology in KPJUC. Okay, today I will explain and discuss with you about schizophrenia disorder. Schizophrenia disorder, we look at the definition first. A psychiatric disorder is a mental illness diagnosed by a mental health professional that disturb thinking, mood, or behavior and seriously increase risk of pain, death, and loss of freedom. And according to DSM-5, schizophrenia spectrum or other psychotic disorder, they are defined by abnormalities in one or more of the following 5 domains, which is delusions, hallucination, disorganized thinking, which is speech, negative symptom, and grossly disorganized or abnormal motor behavior, including catatonia. Schizophrenia involves a range of cognitive, behavioral, and emotional symptoms, and it can be difficult to diagnose. And there are no simple physical or lab tests for schizophrenia. And diagnosis involves the recognition of constellation of symptoms negatively impacting social or occupational functioning. And according to the Diagnosis and Statistic Manual of Mental Disorder, which is DSM-5, the lifetime prevalence of schizophrenia is approximately 0.3% to 0.7%. And the psychotic feature of the disorder typically emerge between the mid-teens and mid-30s, with the peak age of onset of the first psychotic episode in the early to mid-20s for males and late 20s for females. And 5% to 6% of people with schizophrenia die by suicide. About 20% make suicide attempts on more than one occasion, and many more have significant suicidal thoughts. Suicidal behavior can be in response to hallucination, and suicide risks remain high over the lifespan of individuals with schizophrenia. Okay, let's go to the diagnosis criteria. The diagnosis criteria is mean like the symptom that people who have schizophrenia. Okay, first, two or more of the following each present for a significant portion of time during a 1 month period or less if successfully treated. At least one of these must be 1, 2, or 3, which is in DSM-5, the 5 domain, the people who have schizophrenia must be at least have one of these 5 domain, which is delusion, hallucination, and others more. Okay, I will explain and elaborate more in a simple way that you guys can understand what is the criteria in the DSM-5. Okay, the DSM-5 outlined the following criterion to make diagnosis of schizophrenia. Number 1, 2 or more of the following for at least 1 month or longer period of time, and at least one of them must be 1, 2, or 3, which is the 5 domain that I said yearly, delusions, hallucination, disorganized speech, grossly disorganized, and catatonia behavior, or negative symptoms such as diminished emotional expressions. Impairment in one of the major areas of functioning for a significant period of time since the onset of the disturbance, work, interpersonal relation, or self-care. Number 2, some sign of the disorder must last for a continuous period of at least 6 months. This 6-month period must include at least 1 month of symptom or less if treated that meet criterion A, active phase symptom, and may include period of residual symptom. During residual period, only negative symptom may be present. Number 3, the disturbance is not caused by the effect of a substance or another medical condition. And number 4, if there is history of autism spectrum disorder or a communication disorder, childhood onset, the diagnosis of schizophrenia is only made if prominent delusions or hallucination along with other symptoms such as present for at least one. Okay, next we will go to the clarification of 5 domains. Schizophrenia involves a range of problems with thinking, cognition, behavior or emotions. Signs and symptoms may vary, but usually involve delusions, hallucination or disorganized speech and reflect an impaired ability to function. Okay, first, delusions. These are false beliefs that are not based in reality. For example, you think that you are being harmed or harassed. Certain gestures or comments are directed at you. You have exceptional ability or fame, and another person is in love with you, or a major catastrophe is about to occur. Delusions occur in most people with schizophrenia. Next, hallucination. This usually involves seeing or hearing things that don't exist. Yet, for the person with schizophrenia, they have the full force and impact of a normal experience. Hallucination can be in any of the senses, but hearing voices is the most common hallucination. The third one is disorganized thinking, speech. Disorganized thinking is inferred from disorganized speech. Effective communication can be impaired and answer to questions may be partially or completely unrelated. Rarely, speech may include putting together meaningless words that can't be understood, sometimes known as a word salad. And number 4, extremely disorganized or abnormal motor behavior. This may show in a number of ways, from childlike silliness to unpredictable agitations. Behavior isn't focused on a goal, so it's so hard to do a task. Behavior can include resistance to instruction, inappropriate or bizarre posture, a complete lack of response, or useless and excessive movement. And lastly is negative symptom. Negative symptom refers to reduced or lack of ability to function normally. For example, the person may neglect personal hygiene or appear to lack emotion, doesn't make eye contact, doesn't change facial expressions, or speak in a monotone. Also, the person may have lost interest in everyday activities, socially withdraw, or lack the ability to experience the pleasure. Okay, next we go to the type of schizophrenia. In the DSM-5, there are many type of schizophrenia that can be found. For example, there are schizotypal personality disorder, schizophrenia, schizoaffective disorder, schizophreniform disorder, delusional disorder, brief psychotic disorder, catatonia features specifier, substance or medication-induced disorder, psychotic disorder due to another medical conditions, other specified schizophrenia spectrum and other psychotic disorder, unspecified schizophrenia spectrum and other psychotic disorder. This type of schizophrenia have different symptoms and also have different diagnosis criteria. Okay, next we look at the causes of schizophrenia. This is the most common causes that usually happen to someone to have the schizophrenia. The exact causes of schizophrenia are unknown. Research suggests a combination of physical, genetic, psychological, and environmental factors can make a person more likely to develop the condition of being schizophrenia. First, genetic inheritance. If there is no history of schizophrenia in a family, the chances of developing it are less than 1%. However, that risk rises to 10% if a parent was diagnosed by the schizophrenia. Next, neurotransmitter and chemical imbalance in brain. Experts believe that imbalance of dopamine onset of schizophrenia. Research suggests schizophrenia may be caused by a change in the level of two neurotransmitter, which is dopamine and serotonin. The third causes that can be found is family relationship. Family relationship is about there is no evidence indicate that family relationship causes the schizophrenia. However, some patients with this illness believe family tension trigger the relapse. Okay, triggers. Triggers are things that can cause schizophrenia. Triggers. Next, triggers. Triggers are things that can cause schizophrenia to develop in people who are at risk. This includes stress. The main psychological triggers of schizophrenia are stressful life events such as losing your job or home, divorce, the end of a relationship, physical, sexual, or emotional abuse. However, this kind of experience, although stressful, don't cause schizophrenia. However, they can trigger it develop in someone already vulnerable to it. And lastly, the causes is drug abuse. Drugs don't directly cause schizophrenia, but studies have shown drug misuse increase the risk of developing schizophrenia or a similar illness. Certain drugs, particularly cannabis, cocaine, LSD, or amphetamines, may trigger symptoms of schizophrenia in people who are susceptible. Using amphetamines or cocaine can lead to psychosis and can cause a relapse in people recovering from an yearly episode.
Hello, my name is Cecilia Miguel, and I'm an astronomy and astrophysics major here at Penn State, and the founder and president of the Penn State Pulsar Search Collaboratory. In high school, I was lucky enough to have co-discovered a pulsar through the Pulsar Search Collaboratory. A pulsar is a super dense neutron star that emits dipole electromagnetic radiation. So basically think of a star much, much larger than our sun, blowing away its outer layers, leaving behind a dense core. That core could be our pulsar. This discovery opened some doors for me, such as helping represent the United States in the International Space Olympics in Russia, and also being a Virginia Aerospace Science and Technology Scholar. I know what you guys must be thinking, what a nerd. Nerd alert! Well, for the longest time, this nerd had a secret that I was too scared and too embarrassed to tell anyone. That secret is that I have schizophrenia. But what is schizophrenia? It's important to think of schizophrenia sort of as an umbrella-like diagnosis. NAMI shows these different symptoms as ways you could diagnose having schizophrenia, such as delusions and hallucinations being sort of the hallmark type of characteristics. But it's very important to know that a person could have schizophrenia and not have delusions and not hallucinate. Each person's story with schizophrenia is unique to their own. Today, I'm going to be talking about my story with schizophrenia. It's been thought of that I've had schizophrenia all of my life, but it became very prevalent my junior year of high school and then just snowballed into college. February of 2014, my freshman year of college, my life changed when I tried to take my own life through suicide. Why, you ask? Because my life had become a waking nightmare. The following images have been edited using Microsoft artistic effects because they are just too triggering for me. At this time, I had started hallucinating. I started seeing, hearing, and feeling things that weren't there. Everywhere that I went, I was followed around by a clown that looked very similar to the Stephen King's adaptation of It. Everywhere that I went, he would be giggling, taunting me, poking me, and sometimes even biting me. I would also hallucinate spiders, sometimes little spiders, and these are actually the most obtrusive sometimes because we see little spiders in real life, so sometimes this is the only time I ever have difficulty discerning whether it's a hallucination or real life. I'm very good at knowing when I'm hallucinating, and I know that it's a chemical imbalance inside of my head. I don't give these hallucinations even names. I also hallucinate giant spiders, though. One spider in particular comes to mind. It was rather large, leathery skin, dark, black legs, and yellow body. And no voice ever came out of its mouth. However, when it moved its legs, the creaking of the legs sounded like young children laughing. It was very disturbing. But it started becoming unbearable when I started hallucinating this girl. She looked sort of like in the movie The Ring. The thing with her is she was able to continue on conversations with herself and would know exactly what to say and when to say to chip away at my insecurities. But worse was she would also carry a knife around with her, and she would stab me, sometimes in the face. This made taking tests, quizzes, and doing homework in general extremely difficult to impossible when I was in college. Sometimes I wouldn't even be able to see the paper in front of my face because I was hallucinating too much. I don't usually speak so openly about my hallucinations because people usually look at me in fear after I tell them what I see. But the thing is, I'm not much different than the rest of you. We all see, hear, and feel things when we're dreaming. I'm just someone who cannot turn off my nightmares even when I'm awake. I've been hallucinating now obtrusively for about over 4 years. So I've gotten very good at just pretending I'm not seeing what I'm seeing or ignoring them. But I have triggers, such as seeing the color red is very triggering for me. I don't know if you guys noticed this or not, but they changed the carpet that I'm on. They changed it to a black carpet instead of red. I sort of laugh at my life a bit like a dark comedy because, of course, the only color combination that I have issues with is red and white. What is Ted's colors? Really, people? But I have issue with those colors because those are the colors that the clown has, red hair and white skin. And how I'm able to ignore him is I just don't look at him, but I'm able to know where that hallucination is in my peripheral vision because of the bright colors of red and white. But you would never know that I'm hallucinating. The clown is actually in the audience today, and you would never know. On a lighter note, who's looking forward to the Oscars? Hands up? Anyone? Oh, yeah, I knew you guys would be interested in the Oscars. Well, if there were nominations for people just acting normal in everyday life, people who have schizophrenia would definitely be nominated as well. When I first became open about having schizophrenia, it was a shock to even the people closest to me. It took me 8 months. 8 months after my suicide attempt to finally get the treatment that I needed. I didn't even have the diagnosis of schizophrenia. And because of that, what kept me from getting help were conversations like these. I remember very distinctly within that time on the phone with my mother. I would tell my mom, "Mom, I'm sick. I'm seeing things that aren't there. I need medicine. I need to talk to a doctor. Her response? No, 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 no. You can't tell anyone about this. This can't be on our medical history. Think of your sisters. Think of your sisters' futures. People are going to think that you're crazy. People are going to think you're dangerous, and you won't be able to get a job. What I say to that now is don't let anyone convince you to not get medical help. It's not worth it. It is your choice, and it is also your right. Getting medical help was the best decision that I've ever made, and I am confident that I would not be here today if I didn't get the proper medical help. This led into my first hospitalization. I've been in the psych ward 4 times now within the past 2 years, 2-ish years. But I still was not open about having schizophrenia until my second hospitalization because the police were involved. One evening, I realized I needed to check myself back in the hospital because I needed some changes in my medication. So I admitted myself into the emergency room. I talked to the doctors. They said, okay, let's fix the meds. You can stay here overnight. It was all good. After the hospital, the brief one-night hospital stay, I came back to my dorm here at Penn State, and to very concerned roommates, which I understand why they were concerned. If I was in their shoes, I would have been concerned as well. But also the RA and a can-help person. We all talked, and we decided that I needed to have another psych ward stay. And I was okay on going. I wasn't at all refusing, and I was willing to go. But what happened next was inexcusable. They brought police officers into my dorm room in front of my roommates. They patted me down, and I had to convince them not to put handcuffs on me. They then escorted me into a police car that was parked on the road next to one of our most common dining commons, Redifer, where friends were passing by and seeing me put into a police car. By that time, when I came back, the cat was out of the bag. People knew something was up, so I had to set the story straight. I opened up about my schizophrenia through a blog, but I posted all my blog posts on Facebook. And I was amazed about how much support that was out there. And I also realized that there were so many other people just like me. I was actually amazed. A few of my friends opened up to me that they had schizophrenia. Now, I am dedicated to be a mental health advocate. I'm not going to wallow in self-pity about my diagnosis. Instead, I'm going to use it as a common denominator so it could help other people who have schizophrenia. And I am not going to rest until anyone who has schizophrenia worldwide is not afraid to say the words, I have schizophrenia. Because it's okay to have schizophrenia. It really is. Because 1.1% of the world's population over the age of 18 has some sort of form of schizophrenia. That is 51 million people worldwide and 2.4 million people in the United States alone. But there's a problem. Because 1 out of 10 people who have schizophrenia take their own life through suicide. Another 4 out of 10 attempt suicide at least once. I fall into that statistic. You would think that there would already be a nonprofit focused on empowering college students who have schizophrenia, especially since the peak age to have a schizophrenic break is early adulthood, the same age range as a typical college student. But there isn't. There is no nonprofit in the entire United States focused on that. And a general nonprofit focus on mental health in general is not enough, because Even in the mental health community, schizophrenia is shied away from because it makes people feel uncomfortable. That is why I have decided to found the nonprofit Students with Schizophrenia, where we will empower college students and get them the resources that they need so they could stay in college and be successful. Because you could be successful and also have schizophrenia. We need to change the face of schizophrenia because the representation currently is inaccurate. Don't let anyone tell you that you can't have a mental illness and also not be mentally strong. You are strong, you are brave, you are a warrior. Unfortunately, this nonprofit is too late for some. Since I've become open about having schizophrenia, I am asked to come into different classrooms here at Penn State and talk to the class about my experience having schizophrenia. One class stands out in particular. Earlier in the semester, one of the students opened up to the class that she had schizophrenia. I commend her for her bravery. However, by the time that I came and talked to that class, she had taken her own life through suicide. We were too late for her. I was too late for her. Here at Penn State, we have to make an example to the world, because this is not just happening here at Penn State, it's happening globally. But here at Penn State, we have to show that we are here for our students, we are talking about mental health, and we are not afraid to talk about schizophrenia. My name is Cecilia McGow. I have schizophrenia. And I am not a monster. Thank you.
Okay, the video that shown just now is one of the example of the real life of people having schizophrenia. And based on the video, I will explain and summarize the video and about her. As we can see in the video, Cecilia McGow is an astronomer, activist, and writer. As a Penn State's career honor college scholar, pursue a major in astronomy and astrophysics. Cecilia is the founder and current president of the Penn State Pulsar Search Collaboratory. She has been participating in pulsar research continuously since December 2009, and she also was co-discovering the pulsar with the widest orbit and compete in the International Space Olympic held in Russia, which more explained that she was the clever girl, she was the active girl at that time and have the perfect life because she have all of that. And now Cecilia is a mental health activist again in fighting against the negative stigma toward a mental illness. Okay, I will explain and summarize the video. Okay, in junior school, she started to hallucination and delusional. In 2004, freshman of college, she tried to take her own life by suicide. She started to seeing, hearing, and feeling things weren't there. She have been hallucinating about 4 years and until now, and currently she was pretending that she was not seeing and ignoring the hallucination things. And she have the triggered moments when she saw or see the color of red. For example, in the video itself, she said that when she at the TED talk, the production teams even changed their red carpet into black carpet to avoid the triggered moment. She have been hallucinating episode, okay, which can be explained by first episode. First episode, she was followed by a clown that is similar to Stephen King adaptation of It in the movie of It. And the episode consists of the clown giggling, taunting, poking, and sometimes biting her. Next, she was in a multiple episode, which is she started to hallucinate spiders, sometimes a little or big spider. The shape of the spider was large, leathery skin, black leg, and yellow body, and she have difficult time because discerning whether it is real or hallucinate. And lastly, she was in a continuous episode, which is she started to hallucinate a girl, more like in the movie of The Ring. The girl was talking to herself and communicate like her, and sometimes is to eliminate her insecurity. Worst part was the girl was always carrying a knife on her hand, and sometimes she stabbed Cecilia on her face. Okay, and based on the video also, she was diagnosed by the schizophrenia in the term of hallucination, and this is the diagnosis criteria that can be found in the DSM-5, which is she have the following symptom, and also she have the following episode that can be explained in the DSM-5. Okay. Okay, next we go to the treatment. Treatment is the last part that I will explain, and I will discuss with you about how to treat a person with the schizophrenia. Schizophrenia is usually treated with an individually tailored combination of therapy and medication. However, majority patients with schizophrenia have to cope with the symptom for life. Okay. One of the treatment that can be found is antipsychotic medications. For example, risperidone for less sedating than other medicines, clozapine for effective for patients who resist to treatment, haloperidol for antipsychotic that used to treat schizophrenia. Next, electroconclusive therapy, ECT. ECT is a typical used to treat severe depression but also used to treat psychosis symptom. During ECT, an electric current is briefly applied through scalp to the brain and induce the seizure, and also it is given 2 or 3 times a week for a total 6 to 12 sessions. Next is psychological treatment. Psychological treatment can help people with schizophrenia cope with the symptom of hallucinations or delusional better. Psychological treatment for schizophrenia work best when they combine with antipsychotic medications. Common psychological treatment include cognitive behavior therapy, which is CBT, family therapy, and arts therapy. And I will explain all of the therapy. Okay. Cognitive behavior therapy, CBT. The aim of the CBT is to help you identify the thinking patterns that are causing you to have unwanted feelings and behavior, and learn to replace this thinking with more realistic and useful thoughts. Family therapy. Family therapy is a way of helping you and your family to cope better with your condition. It involves series of informal meetings over a period of around 6 months. For example, talk about information of schizophrenia with your family members. And the last one is art therapy. Art therapy are designed to promote creative expression. Working with an art therapist in a small group or individually can allow you to express your experience with schizophrenia. For example, non-verbal way through the arts can provide a new experience of schizophrenia and help them develop new ways of relating to others. Okay, that's all from me. I hope the information was given is very useful for you to use in the future. And don't forget to give a thumbs up, and thank you for cooperating and watch my video. Bye, and have a nice day, everyone.